Huge public service announcement for everyone. If you take long-term heartburn medication, meaning pantoprazole, omeprazole, anything in the proton pump inhibitor family, you're at risk for mineral deficiencies. What's most commonly taught in textbooks is calcium deficiency because if your acid levels goes down, you have a harder time absorbing the calcium in your blood. What's least commonly talked about is the B12 deficiency and the iron deficiency. And sometimes you get both, and that's what makes diagnosing these patients sometimes harder. I was recently referred a patient for anemia, and I did a full workup and I found the standard iron deficiency and B12 deficiency. What's odd is that this patient had a really good diet and they were relatively healthy. I couldn't find the reason for anemia, and as you have to learn from my channel, if you do have anemia, we need to do a full workup. We need to either find some sort of blood loss or we need to find a bone marrow issue. We need to figure out where the blood is going or if it's not being made. After a detailed history and thorough examining the patient and doing some extra blood work, I went through her history one more time and I realized, how long have you been on this proton pump inhibitor for? And the patient said 5 years. The proton pump was started years ago when she was on steroid for completely something irrelevant, and it was never taken off by her primary care because she never brought up to her primary care, and she just kept getting these refills, and no one ever questioned it because the patient was feeling better. And now she's coming with all these mineral deficiencies. This is just a reminder that if you don't need a medication, don't take it. Every medication, even the ones that are most commonly used in society, can have side effects.